addition to patient assessment. Special training is required to use IP monitoring.
The LifePac 15 monitor defibrillator can graphically display and document the patient's vital signs and ST segment measurements over time with the trending feature. Here's an example of an SpO2 trend graph over 30 minutes. When the trending feature is on, the monitor samples and stores data from all active vital signs at 30-second intervals. You might see a blank space like this on the graph if data was unavailable at that point for any reason. You can display trend graphs in Channel 2 and 3. The patient's ST segment measurements can be trended just like each active vital sign. ST trending starts with the patient's first 12-lead ECG. The part of the patient's ST segment that is measured is the J point. When a 12-lead ECG is obtained, the LifePac 15 automatically chooses the lead with the most STJ displacement to display on the graph. As long as all 10 lead wires remain connected to the patient, it will measure STJ every 30 seconds and plot it. If a lead is off or the ECG data is too noisy, ST measurements are not obtained and the graph shows a blank for that period. If an STJ in any lead deviates from the initial measurement by 1 millimeter or more, and the deviation persists for 2.5 minutes, the monitor automatically prints another 12-lead ECG. To print the trend graphs, select Options, Print, Report, Trend Summary, and Print. Vital sign and ST graphs are tools to be used in addition to patient assessment.
When the LifePac 15 monitor defibrillator is set up to power on in AED mode, it follows a predetermined protocol. AED mode is intended for use only on patients in cardiac arrest who are unconscious, not breathing normally, with no pulse or other signs of circulation, and at least 8 years old. We're going to look at how AED mode operates using PhysioControl default settings. But be aware that the 15 can be set up differently based on your organization's medical direction. Make sure you're familiar with how your 15 is set up for your protocols. So, let's begin. You have an unresponsive patient. Verify the patient is not breathing normally and has no pulse or other signs of circulation. Turn on the defibrillator. If you can, get the patient onto a hard surface and away from any standing water. Bare the chest. Prep the skin if necessary, as we described in the ECG monitoring section. Place the electrodes in the anterior lateral position as shown in the picture on the back of the electrodes. Make sure the electrodes do not touch each other, lead wires, ECG electrodes, dressings, or medication patches. Be sure the entire electrode surface adheres to the skin. Place electrodes away from implanted devices if possible. Use fresh electrodes if you have to reapply them.
Push Analyze.
This message appears and stays up until you push the Analyze button. No one should move the patient during analysis, so stop CPR and make sure everyone is clear of the patient. Then push the Analyze button.
Analyzing now. Stand clear. Shock advised. Stand clear. Push shock button.
Before you push the shock button, look around to make sure everyone is clear of the patient and clear of anything in contact. Make sure concentrated sources of oxygen are well away from the patient's chest. If it's not safe to push the shock button, you can press the speed dial to cancel the charge. Or if you don't push the shock button within 60 seconds, the defibrillator will automatically cancel the charge. You'll see this message.
Push Analyze.
Push Analyze again to reanalyze and charge.
Analyzing now. Stand clear. Shock advised.
Okay, all clear? Now push the shock button. The defibrillator delivers the shock and gives you this message.
Start CPR.
The CPR metronome helps you time compressions. There's a message down here to show you the compression of ventilation ratio for the metronome. When it's time for ventilations, the metronome prompts you.
3, 2, 1. Ventilate. Ventilate.
If you want to silence the metronome, press CPR. To resume the metronome, press CPR again. At the end of CPR time, the AED prompts for another analysis.
push, analyze.
And the whole sequence repeats. Okay, let's go back to the beginning. You've determined the patient is in cardiac arrest. You followed the screen prompts and pushed analyze.
Analyzing now. Stand clear.
But the AED does not find a shockable rhythm. You get this message.
No shock advised.
Then it goes straight into
Start
CPR
CPR.
time with the metronome and ventilation prompts. At the end of CPR time,
Push, analyze.
it tells you to push analyze, and the cycle repeats as necessary. When advanced users arrive, manual mode may be accessed according to how your 15 is set up. It's important that you're familiar with how to access manual mode in your device. Now, here are a couple of situations that might come up while you're using AED mode. For example, you get the motion detected message.
Motion detected. Stop motion.
This message might come up while the AED is trying to analyze the patient's heart rhythm, but some kind of motion is interfering with the signal. You should figure out what's causing the motion. Is the patient breathing? Is there transport motion? Is someone touching the patient? CPR, agonal breathing. Remember, do not analyze the patient's rhythm during transport. Motion artifact may affect the ECG signal, resulting in an inappropriate shock or no shock advised decision. If the motion is something you can stop, stop it. One other possibility is that there is some kind of electrical or radio interference. Look for anything that might be a source of that kind of interference, like radios or cell phones, and move it away. If the interference is not something you can stop, like agonal breathing, just wait. The AED will finish the analysis and give a decision, even in the presence of motion.
Analyzing now. Stand clear. Shock advised.
Now, if you have everything connected, but you get this message,
Connect electrodes.
there may be too much patient hair preventing good contact. Remember to shave excessive hair before applying the electrodes. Or maybe something is wrong with your therapy cable. Check your therapy cable daily using the test load provided with your defibrillator. If you have everything connected and you get this message, connect cable, it's likely that something is wrong with the therapy cable. So again, check your therapy cable daily.
Manual defibrillation. First, let me mention that the PhysioControl default configuration for the LifePac 15 monitor defibrillator is to power on in manual mode. If your 15 has been set up to power on in AED mode, access to manual mode might be conditional. It's important that you are familiar with how your defibrillator is set up and how to access manual mode on it. Okay, the 15 is on, we're in manual mode, and we have confirmed that the patient is in cardiac arrest. Place the electrodes in the anterior lateral position. Make sure the electrodes do not touch each other or lead wires, ECG electrodes, dressings, or medication patches. Be sure the entire electrode surface adheres to the skin. If you know the patient has an implanted device, place the therapy electrodes away from it if possible. If you have to reapply therapy electrodes for any reason, replace them with new electrodes. 200 joules is already selected. If you want a different energy level, press Energy Select. Choose the energy level you want. Press Charge. There's a charging tone and a charging bar. Now it's fully charged and you can see the available energy. Look around and make sure everyone is clear of the patient and anything in contact with the patient. Make sure concentrated sources of oxygen are well away from the patient's chest. Look at the screen again to confirm that the rhythm is still shockable. If it's not safe to push the shock button, you can cancel the charge by pressing the speed dial. If you don't push the shock button within 60 seconds, the defibrillator will cancel the charge automatically, and you'll see this message. In a case where you do push the shock button, the shock is delivered. Start CPR according to your protocol. To activate the CPR metronome, press CPR. The CPR metronome menu appears, and the metronome is activated using the default setting, Adult, no airway, 30 to 2. If you want to change the metronome setting or stop the metronome, use the speed dial to highlight and select the choices. The metronome gives you talks to time compressions and prompts for ventilation.
3, 2, 1. Ventilate. Ventilate.
At the end of your CPR period, stop CPR briefly and assess the patient's rhythm. Repeat the shock sequence if necessary. For more information on the CPR metronome settings, refer to the operating instructions. Okay, let's go over a few troubleshooting tips. Now, if you have everything connected and you push the charge button, but you get this message, connect electrodes, there may be too much patient hair, preventing good contact. Remember to shave excessive hair before applying the electrodes. Or maybe something is wrong with the therapy cable. Check your therapy cable daily using the test load provided with your defibrillator. If you have everything connected and you push the charge button, but you get this message, connect cable, it's likely that something is wrong with the therapy cable. So again, check your therapy cable daily. If you're attempting to defibrillate but nothing happens when you press the shock button, check to see if sync is on. If it is, turn sync off and proceed with the defibrillation.
Let's go through the steps to perform a synchronized cardioversion. Prepare the patient for the procedure according to your organization's protocol. The defibrillator is on and the patient is hooked up to a 4-wire ECG cable. We are monitoring lead 2. We're using this lead because it's the lead that gives us the tallest QRS complexes. You want to choose the lead with the greatest QRS amplitude or height. It doesn't matter if it's negative or positive, just that it's tall. Now press the sync button. At the bottom of the screen, you can see the sync mode message telling you that you're in sync mode. The triangles on the ECG are the sense markers. They should appear near the middle of each QRS complex. Don't worry if the placement varies a little bit. If you don't see them at all, adjust the ECG size or select another lead. The sync LED flashes with each detection. Prep the patient's skin and place the therapy electrodes the same way we did for manual defibrillation. Now press Energy Select and select the energy according to your medical protocol. We'll select 100 joules. Okay, now press Charge. Now it's fully charged, and here you can see the energy available. If you need to, you can cancel the charge. Before you shock, look around. Make sure everyone is clear of the patient and clear of anything in contact with the patient. Make sure concentrated sources of oxygen are well away from the patient's chest. Look back at the screen and confirm that the sense markers are still sensing appropriately. Good. Now press and hold the shock button until it shocks the patient. That slight delay before the shock was delivered was because the defibrillator discharged on the next sensed QRS. Wait until you see the screen message Energy Delivered before you release the shock button. After the shock, assess the patient and the ECG rhythm. The PhysioControl default for the LifePac 15 is to return to asynchronous mode after a shock is delivered. But your organization might have changed this default setup. Make sure you're familiar with how your 15 is set up for sync mode in your organization. If the arrhythmia persists and you want to shock again, press sync again. Confirm sense marker placement on the ECG, increase energy according to your protocol, and repeat the charging and discharging sequence. And that's sync cardioversion. Okay, let's go over a few troubleshooting tips. Now, if you have everything connected but you get this message, connect electrodes, there may be too much patient hair preventing good contact. Remember to shave excessive hair before applying electrodes. Or maybe something is wrong with the therapy cable. Check your therapy cable daily using the test load provided with your defibrillator. If you have everything connected and you get this message, connect cable, it's likely that something is wrong with the therapy cable. So again, check your therapy cable daily. If you have a patient in ventricular fibrillation and you're attempting to defibrillate but nothing happens when you press the shock button, check to see if sync is on. If it is, turn sync off and proceed with the defibrillation. For various reasons, some patients' ECG leads are of low amplitude and difficult to sense appropriately. If this is happening, cycle through each ECG lead until you find the lead with the largest QRS and then increase the ECG size if you need to.
The LifePac 15 monitor defibrillator can be used for either demand or non-demand pacing. Demand pacing is used for most patients, so that's what we'll show here. First of all, before you start pacing someone, always consider the need for patient analgesia or sedation. Okay, connect the ECG leads to the patient. You need to do this for demand pacing, so the pacemaker can see the patient's own beats and deliver pacing pulses only when needed. Also, although the quick combo electrodes can be used both to monitor ECG and for pacing, they can't do both at the same time. So, here we go. We have the ECG leads on and lead 2 is displayed. Now we'll place the therapy electrodes. We'll use anterior-posterior here. You can use either the anterior-lateral or anterior-posterior position. Prep the skin as we showed you in the ECG monitoring section. Place this electrode with the heart over the left precordium, just below the nipple. It's important to put the electrode with the heart here rather than on the back, because if the electrodes are reversed, it might require a higher current to achieve capture. Place the other electrode on the patient's back in the infrascapular area, like this. Be careful to keep adequate separation between the ECG electrodes and the therapy electrodes to minimize artifact on the ECG. Press pacer. You should see sense markers on each QRS, like these. If you don't see sense markers or they're on the T-wave, adjust the ECG size or select another lead until you do see sense markers. Now, press rate. Press the up or down arrows to get the rate you need. Press the current up arrow repeatedly to increase the pacing current. Now you can see these pace markers, indicating that pacing current is being delivered. You should notice the patient beginning to twitch. Increase the current until you see electrical capture. You'll have electrical capture when each pace marker is followed by a wide QRS and a T-wave, like this. It's important to be aware that the average current needed for capture is between 50 and 100 milliamps. The final step is to ensure that you also have mechanical capture. Palpate the patient's pulse and obtain a blood pressure. Pulse oximetry may also be useful. Observe the patient continuously while actively pacing. The patient's response to pacing therapy may change over time. If you need to check the patient's underlying rhythm, press and hold pause to temporarily reduce the pacing rate. Release the button to resume pacing at the set rate. To stop pacing, press pacer. A few more things. During pacing, you always see dashes up here instead of a heart rate, and the heart rate alarms are disabled. It's important to frequently assess the patient for mechanical capture. If an ECG lead comes off, pacing switches to non-demand, and the monitor shows a dashed line for the ECG. This means the pacemaker paces 100% at the set rate, regardless of the patient's underlying rhythm. To re-establish demand pacing, reattach the ECG electrode. If you're increasing the current, but the patient is not twitching, check the patient's heart rate. Remember that the pacing rate needs to be set higher than the patient's own rate for pacing current to be delivered. If you're pacing and the patient needs to be defibrillated, press charge. Pacing stops automatically. Proceed with defibrillation as described in the manual defibrillation section. And that's it for pacing.